there, my CareWork friends. It's Trish Richardson here, Chief Nursing Officer at CareWork. And joining me today for a CareWork conversation is Vicki Sherrard. Vicki will share just a little bit about her experience with the CareWork Unified Operations Platform. And Vicki is joining us. She is the Senior Vice President of Clinical Services, the Chief Compliance Officer, and Chief Risk Manager for Beacon Health Management. And she brings, I am so impressed, my friend, more than 40 years of experience. She is a nurse leader. She's been in the long-term care industry since 1996. And Beacon Health Management currently has 26 skilled nursing locations under management. So Vicki, thank you so much for being with me this morning. And I want to go ahead and just dive right in. So we're going to talk a little bit about what your processes were like before the implementation of the CareWork platform, and specifically around some of the reports that are automatically generated for you. So before CareWork, if you could talk just briefly about what your process has been or was for compiling and distributing, let's talk about your clinical quality measures across the organization. What did that process look like for just gathering all that data and reporting all that out?
Well, quality measures was always quite the task in the past, because it gave me an opportunity to study each facility and look at their quality measures per the Beacon standard that we set, and then the national and state standards, or averages, if you will. However, as much as I enjoyed that review of the data, the gathering of the data was so cumbersome that it would take a day and a half for me to pull everything together from a manual perspective and give us a good picture of where we stood. So it was a dreaded task each month, because I had to spend all that time gathering the data, and then I would do a summarization, analysis, summarization, send it out to the facilities along with directions on each facility of where they needed to put their plan of action and efforts as far as that's concerned. Mm-hmm. Quality measures, albeit, is a very important report for us, but the emphasis of time and focus of time should never be on the gathering of the data. So I found that to be such a waste of time, even though the outcomes are what I was looking for. The actual gathering just took too much. It was laborious, and it just took too much as far as excuse me, my own management time, so that it took away from the analysis, which is where I needed to be.
Yeah.
So in using CareWork platform, I get it in 5 minutes. Excuse me. I get it in 5 minutes, so I can then spend the majority, or however much of my time I want to, doing the analysis of the data. And the data comes to me each month by the 5th, and I can look at it, make my analysis, put my summary together, and let my facilities then work on their plans of action. So it has been a godsend for me as far as time saving, and as far as actually working smarter, not harder, and making my focus on the actual review of the data instead of the gathering aspect.
Yeah. Oh my goodness. I love everything. I love everything that you just said. It makes absolute sense. And I appreciate you being so, forthcoming about how long it took you before. You said, I think, a day and a half, and now it's 5 minutes. It's almost like it's a click and it's done. It's there. It's ready for you. I remember in my experience having to go find the spreadsheets, find the data, gather it all together. We had analysts that specifically did that in our work, that pulled all the information together. Then we had to go out and report out and then take action. For you, like you said, it's there in a moment's notice, and then you can spend the time where you want to, where you need to, where you should be, focused on the quality, focused on the actual trends and the analysis. And I know that has been, in your words, it's been a tremendous time savings for you. Are you seeing that you can proactively lean into some of the quality concerns before they can maybe negatively impact, maybe with surveys?
Yes, I have. The way I've got this set up is accumulative, so I can see month over month over month, and I can make a determination if we are trending in the proper manner or the proper direction. The way I look at it, Beacon Health Management does not pay me to gather papers or to gather numbers. They pay me to analyze those numbers and make a determination or a predictive analysis of where we're going or what we need to be doing to counteract something that might be trending out from that perspective. I look at that overall as an ability. This time savings gives me the proper ability to spend, instead of trying to juggle more things with less time. I can actually focus on the trending. I can focus on the facility's performance and then direct my regional nurse consultants as well on how to assist those directors of nursing and clinical teams on to have improved outcomes, or to make sure that they are putting their efforts toward improved outcomes. I wasn't able to do that as much in the past because it just took too long. It absolutely took too long. And as you mentioned in the beginning, my titles, I do quite a few things for this company, and there's not one thing that I can spend just enormous amounts of time on. I have to be able to have quick, efficient, effective systems and management tools that work for me to get the data, review the data, analyze the data, distribute the data, and give directives from that 30,000 foot viewpoint, if you will. And utilizing this, particularly in the QMs, that was the first report that I wanted CareWork to work on for me, because I was like, I got to do something different than what I'm doing. It's not smart, it's not cost effective, and it certainly was not producing the outcomes I wanted. This, I think, will absolutely do that. So I'm very pleased with it.
Oh, I'm excited. Thank you so much for sharing about that and sharing your experience and what the platform has been able to do for you to give you that critical time savings back to intently focus on the analysis. And it all comes back down to the patient and resident experience and the safety of the care environment. And you think about what that can be for their clinic, for their experience and their outcomes. And that's what it's all about. It's taking the best care of our patients and residents, and knowing that you have the data in your hands in a moment's notice, and you have that critical time savings to focus on those care areas that matter the most. So, but I know your time is busy, and I so appreciate you spending a few minutes with me this morning. And I look forward to having a few more conversations down the road as we continue to see more positive impacts of the CareWork platform as it's continued to roll out in your organization.